So for today's presentation, we're going to talk about tips and tricks for finishing and polishing our restorations. I do want to recognize the financial support that we have received from the companies that you see on this slide: Oral Arts Dental Laboratories in Huntsville, Alabama, Colteen, Comet, B and Air. Through this financial support, we will be offering one free CE credit this morning, and I'll show you what you need to do in order for you to be able to receive this CE credit through our PACE, through the Academy of General Dentistry PACE system. So the first thing I want to put out there is our objectives for today. Our first objective is going to be identify the rotary instruments recommended for finishing and polishing, effectively use a sequence finishing technique, and effectively use a sequence polishing technique. Please don't forget to visit our webpage, www.romerodentalseminars.com. When you get into our webpage, you're going to go in and you're going to click on the, let me go back to this. You're going to click on live webinars. And if you go to live webinars, you're going to be able to subscribe to our future webinars. So make sure that you check out that aspect of our webpage. You can always use our on-demand feature where all our webinars are recorded and you are able to access them through our webpage without any issue. So make sure that you go and visit them, because you will find some older webinars that are going to be related to what we're going to be sharing with you today. And finally, you will have our CE quizzes. This is where you're going to have to go if you want to take advantage of our one CE credit for today. You go into this CE quizzes and you're going to find a link that would say finishing and polishing. You download that PDF file, answer the questions, complete the information that we request from you, and then email us back that form, that completed form, and you can email it back to romerodentalseminars@gmail.com. So our tip and trick number one for today is going to be our recommended polishing instruments that I have placed here in this slide. And I just want to walk you through the process so that you can see what we have. You know, many people ask me if I use every single one of these, rotary instruments every time I'm going to finish and polish a restoration. And the answer to that question is no. I don't use them all, but it really depends on how much detail, how much superficial texture, how much anatomical details you have to reproduce on your completed direct restorations. And it's really based off, out of what the patient presents on his neighboring teeth, on his natural neighboring teeth. But one thing I can tell you is that if you have a patient that has a lot of these distinctive features like developmental groove, superficial, scratches or texture, if you have a patient that has all these little features included in his enamel, and you have to reproduce it on your restorations, you're most likely going to use a lot of these, if not all of these rotary instruments that I'm sharing with you here in my slide. So keep that in mind, and that's the reason why I have outlined here, and you can see that I have named them. You will find right next to them the reference number that you can use. I'm actually giving you the brand name, the company that actually makes these burrs. But as you all know, many other companies fabricate burrs like this. So it really depends on the brand that you normally use. These are the ones that I use, and these are the ones that I recommend. But at the end of the day, it really depends on what you can get in your markets and what company you like to work with. Now, you will see throughout my presentation that I'm going to refer to these numbers so that you have a clear understanding of where do I use them and why do I use them. And I'm going to walk you through the process of using every single one of these instruments, step by step, so that you know exactly when to use them and how to use them. Now, the first thing that I want to share with you is using your disc. And I normally use a Swiss Flex system from Colteen. And one of the things that I like about this system, and again, it really depends on the system that you use, is that you have, this system goes all the way from a super coarse finishing disc all the way down to a high luster finishing disc. So if you were to use only this Swiss Flex system, you're gonna be able to achieve high luster. Now, I don't go through the whole system myself, and I'll tell you why in a little bit. But I do think that having these first two couple of discs, or either the super course or the course, are the ones that you're going to be using the most, the ones that I use the most in the technique that I use with my patients. And again, I'm going to share with you a step-by-step sequence, and I'm going to tell you why I use these. Now, if I have to choose between the super course and the course, I can tell you right now that 90% of the times I only use the course a disc. I don't use the super course. Now, I do have the super course because I do have some cases where I just end up having a little bit of more over contours of my restoration that I would want to. And for that reason, I'm going to have to remove a little bit more of the composite until I get to a nice anatomical restoration. But normally, what I try to do and what I recommend people doing is try to layer your composite to almost a perfect finish, so that there's very little finishing that you're going to have to do, contouring and finishing that you're going to have to do initially. And because I always try to do that, I'm going to always stick to the coarse disc. This is the one that I'm going to use the most because there's very little over contouring that I'm going to have to reduce, and it's a lot easier for me to reduce it with a disc that is that is not as aggressive like a super coarse disc. I don't want a very aggressive disc because there's not a lot that I want to remove. So I want to have better control of the amount of composite, of the amount of finishing or contouring that I'm going to be doing initially. So that's what I get when I use this coarse Swiss Flex disc. And the reason why why I don't go all the way down through the super fine or high gloss or high luster disc is because I like to finish my composite restorations using these silicone wheels. And again, there's many like this in the market. This is the one that I normally use, and this is the one that I'm going to share with you today. And you'll see what kind of luster you are able to obtain with these kind of silicone wheels. And this is a system from Colteen called Shape Guard. And what I like about this system is that it's a very simple two-step technique. And you can see it right here. You have this pink and green or bluish type of silicone polishing wheels. You have two different sizes, and they're very soft. So you will be able to use these not only on the facial aspect of anterior teeth, like mandibular or maxillary incisors, but you are able to use a smaller size on occlusal surfaces of posterior teeth. And you will be able to achieve the same type of high luster that I would like, that we all like to achieve in our completed or final restorations. So again, I'm going to show you how to use these wheels, and this is what I use to achieve my high luster. So I don't use my Swiss Flex, the finer Swiss Flex disc to achieve that luster. I go from my medium coarse, and then I use other instruments that I'm going to share with you soon, and then I go all the way down to this Shape Guard wheels to achieve the high luster that I'm going to share with you how to achieve in my presentation today. So my tip and trick number 2 is going to be the actual advanced polishing technique. And in order for me to share the concepts and to share this step-by-step technique, what I'm going to do for you is I'm going to use a plastic tooth that I have restored with composite. And again, I'm going to walk you through the process of achieving every single aspect, perichematia, roughening or scratches, small scratches of the surface, developmental groove, very well developed line angles, and high luster. I'm going to walk you through the technique of how to achieve every single one of these particular features within the tooth. Not because you're gonna need them, you're gonna need to use them all the time, but just in case you are confronted with the case that you are going to have to reproduce every single one of these features, I'm going to share with you how you go about working with this. So the first thing that we have to understand is that when we are layering our composites, when we are developing the anatomical features of our restoration, one of the most important aspects of a completed restoration of a layering technique is developing what we call the line angles. And this is the gingival, the mesial, the gingival up here, the mesial, and the distal line angles. And we do that, and we share that with you in a webinar, in a tips and trick webinar that we had a couple of months back, that you can go back and watch it in our on-demand library. But we taught you how to use this mylar pull technique in order for you to develop these line angles. And these line angles are very important because we all know that one of the most important features that we want to try to achieve when we are working with direct restorations is that ideal or correct mesial distal width of the tooth and our ideal or correct anatomy or shape of the tooth in relation to the neighboring teeth. So as we all know, we can have teeth that are either triangular, square, or ovoid. And depending on the shape of the tooth that you want to achieve, that's why I'm going to use this a very thin lead pencil, and I'm going to mark the line angles depending or based out of the shape that I want to ultimately achieve on my completed or final restoration. In this particular clinical example that I'm sharing here with you, what I'm going to try to do is I'm going to try to transfer this more square type of tooth into a triangular shape tooth. And this is why with this lead pencil, what I recommend you doing is going into the tooth and drawing, highlighting the line angles that you were able to achieve in order for you to obtain this triangular shape. I'm going to draw more of a triangle than a square. If you wanted to make this tooth more ovoid or square, well, you will follow a more square or ovoid pattern. But in this particular case, my goal is to make this tooth appear to be more triangular in shape. So that's why I went out and outlined this triangle, I'm sorry, that you're seeing right here on these line angles. Now, the most important aspect is that I know that my facial aspect, what's in between these line angles, I'm going to work on that area using a different instrument. I'm not going to use my disc to achieve the ideal shape of the facial aspect of my line angle. The only area that I want to be working with, or what I want to be working on uh, when I'm using this coarse disc, this first step is what's outside this line angles. So this area that is outside this line angle that you can see over here on this right-hand side, that I have created a little bit of, I've just created some little lines with my pencil outside my line angles. This is the area that I want to intervene at this point. This is the area where I want to get what I want to, that I'm going to use to reshape and modify and taking this tooth from more of a square shape to a triangular shape. This is the area that I need to modify. And one very important aspect of this is that when you modify this area, and again, I'm going to use this disc, this coarse disc, to modify this area, all I'm going to do is use the active surface of the disc to go around distal, gingival, and mesial. And as you can see on this photo, I have not gone in between the line angles. This facial aspect is something that I'm going to use a totally different rotary instrument to work in that area. So the only area that I'm going to be working around is outside the periphery or the perimeter of the line angles. And this is why it becomes so important that we all understand that when we are layering our composites, we want to try to achieve almost an ideal shape of the tooth with our hands, with our layering technique, so that our finishing and polishing processes are really minimal. This should not take that long for us to do. So once you go about removing or reshaping the tooth outside these line angles, one very important aspect that you don't want to get involved in is in the interproximal contact areas that you can see that I have highlighted in red in the mesial, in the distal and mesial aspect of the tooth that we are polishing right now. And why is this important? Because this coarse disc is too wide. The width of the disc is just too much in order for us to get in interproximally. And if we do get into the interproximal area, we are going to remove the contacts in between our neighboring teeth. So we want to make sure that we do not modify the interproximal contacts. This interproximal area is something that you want to polish using finishing strips. And the technique that I shared with you in a previous webinar, this mylar pull technique, what I like about the mylar pull technique is that it really allows you to achieve a smooth interproximal contacts throughout the process of layering your composite. So the finishing aspect with a finishing strip interproximally is going to be very, very minimal. And this is very important because, as you all know, if you work too much in this area, you're going to end up with an open interproximal contact, and we do not want that to happen. So here again, we have gone around that the line angle that we're able to draw in that facial aspect. We are now, you can see that this tooth now is not a square anymore, is now more of a triangular shaped tooth, just because we modified the shape outside those line angles. But the most important aspect is that we have not gone into the interproximal area. There is no polishing in that area. We are just facial to the interproximal area so that we don't open any of our interproximal contacts. So now, once you have modified the outline shape of the tooth, in a case where you needed to do that, and in this particular case, we chose to go from a square tooth to a triangular shaped tooth, the next step is now going to be the facial aspect. And for this particular step, we are going to use this 8888 FG012 shaped diamond made by Comet. And this is the actual reference number that Comet uses to be able to provide this bird to you. If you want to purchase this bird, this is the number that you're going to have to give them. But overall, this is what we call the 8888 diamond burr. And what I want to share with you here is the way that we're going to use this burr. This burr, you should never use this burr flat on the facial aspect of the tooth. You should always remember and remind yourself that the facial anatomy of any incisor is going to have three well-defined planes. The gingival plane, and this is the one that we're working on right now. We want to make sure that it's nice and even, and there is no over contour of the composite in that gingival aspect. Then we're going to take this to what we call our facial plane, and you can see the difference in the angulation of the burr. So the first angulation is more of a kind of like a 45-degree angulation towards the gingival aspect of the tooth, so that we eliminate any over contours in the gingival aspect. This second plane is more of a vertical position of the burr, and you can see that we are now contacting only the true facial gingival third and middle third of the facial aspect of the tooth. And then finally, we're going to go about the incisal third. And I want you to see in the incisal third, we are literally just in contact with the lower portion of the middle portion of the middle third and the actual incisal third of the tooth. And what is it that we're trying to achieve? I want you to look at the right-hand side and look at the facial anatomy of this tooth. We have been able to identify and to reduce the over contour of the facial aspect following those three planes of anatomy, of the facial anatomy of the tooth. And again, how do we achieve this? We achieve this with this 8888 diamond, flame-shaped diamond burr. So first step, you're going to use a medium coarse disc, and we're going to go just around that line angles. And then on our second step, we're going to now modify the actual facial anatomy, and we're going to give this tooth the shape that we're looking for, these three planes, facial planes, and we're going to do that with the 8888 diamond burr. Once we complete that, we should now have a very nice anatomical shape for that tooth. And all we want to do now is concentrate on the more detailed or tertiary anatomy that we can find within this facial aspect of the tooth. And one of the things that we can find normally in some young patients' teeth is what we call the developmental grooves. And again, the size and the width, the length and the width of these developmental grooves has direct relationship with what the patient presents on his neighboring natural teeth. So there is no right and wrong in regards to size when it comes down to us developing or actually creating these developmental grooves in our finishing process. In this particular case, I am considering this tooth a much younger tooth, so I'm going to create a mesial and a distal developmental groove. You can see that the mesial developmental groove normally is a little bit taller in regards to the distal developmental groove. And if you want to do that, and that's what I'm going to do for this tooth, again, I'm going to use the same 8888 diamond burr. And the reason why I like using this burr for this particular objective is that it has a kind of nice and round tip. It does not have a sharp tip like a needle tip. And this is very important. You do not want to use any needle type of burrs for this type of procedures, because you will create very deep cuts, and it's going to be very hard for you to polish within these cuts that you create to develop or to create these developmental grooves. So you can see that I'm going in and I'm just going to go just very slowly, stall speed. I'm going to create a depression in the mesial aspect of the tooth and another depression on the distal aspect of the tooth. And you can see up here on the right hand side that I have been able to create these two developmental grooves, these two depressions. I want you to look at the anatomy of the depression. They're not sharp, they're nice and round because they are following the shape of this burr. We are going to go in and we're going to smooth and we're going to make these a little bit softer, and I'll show you how I do that. But for now, all you want to do is just create these two depressions. And again, you're going to do this at a stall speed. Don't put your foot on that rheostat and make this burr spin, rapidly. You want to use stall speed, and you want to use just light pressure, just one pressure in and out, so that you can create these developmental grooves. Once you have the right anatomy for your developmental grooves and you're happy with them, you can now go to the next step. And again, all the teeth do not have all these, all the teeth that you're going to be restoring out there. They're not going to have all these anatomical or superficial features. But if they do have them, you have to have a technique to reproduce them. This is what we call the perichematia, and you can see here, these are more horizontal kind of depressions that are in the tooth that you can find in some of your young patients' superficial anatomy. And if you have to reproduce them, you're going to use, I normally use a large round burr, and this is the 8801 FG007 diamond burr by Comet. And again, you saw me go from side to side, and you go from either left to right or from right to left. And you're just going to go in and out. You stall speed, you go in and out, touch very light touches, and you're going to do this multiple times. These horizontal lines, these are most likely present in the gingival third of the tooth. And if you find them there, that's how you're going to do them. You're going to go very small depressions. And this is what you're going to see. You're going to end up having, as you can see here, developmental grooves. And now you have this perichematia on the gingival aspect. This needs to be polished. Once you develop these with these burrs, you can see that you're going to have some scratches, some white debris within those depressions. So what you need to do now is that you need to use, and I like using an enhanced point, and this is done by Dentsply. I like using an enhanced point, and I always use it underwater. And I'm gonna put a little bit of water on the tooth, and with the water on top of the surface of my composite, I'm gonna go in using this enhanced point, and I'm gonna go into all the little irregularities that I have created on the surface of this tooth. And you can see the difference between the middle tooth and the tooth right on the right hand side. You see a lot of the white spots, a lot of the scratches that I have been able to create with these burrs. Now you can barely tell they're there. Now they're still there, but they're now polished. You want to make sure that you don't leave any of the white spots behind. So this can take some time, and you want to make sure that you always do it underwater. So I have my dental assistant with a with the air water syringe right on top of the tooth, and I just have her, dispense drops of water, one drop every 2 to 3 seconds, and I constantly have her wetting the tooth in order for me to be polishing with the enhanced point. Always a wet surface, and you want to make sure that you don't put in a lot of pressure with the enhanced point. It's more of a mild pressure, stall speed, but again, you want to make sure that you dry the tooth and you don't see any of the white spots left behind. And you can see here that once you do that, if you have to create added texture to your surface, and this is something that you normally are going to have to do, because you may find some teeth without any developmental grooves, you may find some teeth without any perichematia, but you were always going to find some teeth with superficial scratches, so superficial texture, very small scratches. And this is when I use this more of a needle shaped or sharp end type of burr. You can see it has a very small active diamond and very fine diamond. This is the 8852 FG012 burr from Comet. And again, what I use this burr for is I'm just going to create some superficial, very small scratches in between the developmental grooves and more towards the cervical aspect of the tooth, just to generate some superficial texture. This is something that I do 99% of the times. I may have some patients that again don't have any developmental grooves, don't have any perichematia, but normally they do have some superficial scratches, and this is the burr that I'm going to use to achieve that. And you can see here now between the developmental grooves that I've created very, very small and very superficial scratches that again, you're going to now use a different enhance. Instead of the enhanced point, I'm going to use now the enhanced disc. And again, under running water, I'm going to be able to just smooth out those scratches. So the scratches are not going to be eliminated by this disc because we're not putting a lot of pressure on the tooth. But what's going to happen is that all these little superficial scratches are going to become highly polished, as you can see on the right hand side. This is me without using the shape guards. This is me just using this enhanced wheel in order for me underwater, in order for me to achieve this medium luster or medium shine on the actual surface of my composite. Now I'm ready for my final high luster step. And as you can see, I don't use any polishing paste. I don't use any fine polishing disc or shape a Swiss flex disc. All I'm going to do is jump from this enhanced wheel to my shape guard finishing wheels like you're seeing right here. These are silicone wheels. And again, I'm always going to use them at stall speed. I'm going to use them always under a little bit of water, just drops of water on top of the tooth. I always do my entire finishing process under water. I do not recommend doing it dry. And you will feel now all this, I've summarized this, but I want you to understand that all this, it takes its time, and you want to use probably you want to buff first using the pink one, and then you want to go to the blue one to get your high luster. And what you want to try to do, this is a step 2, and this is going to give you a super high shine. And I'm going to show you a couple of real clinical cases so that you can see how much of a shine you are able to achieve just by using these polishing wheels without any paste, without any more of your fine disc. And again, what I like about these wheels is that they allow me to, they give me a high luster without removing all these little superficial texture details that I've created using all the steps that I have shared with you previously. Now, this photo was obtained of the same plastic tooth that I've been sharing with you from the beginning. And this is after every single step that I've shared with you. And what I want you to see is look at the mesial aspect and look at the superficial texture that I was able to achieve and to create here. They're very subtle. I'm using a very nice photo technique so that I can have some light reflected by the tooth. And this shows you not only the high luster, how the super shine that I was able to achieve, but most importantly, I was able to keep all these little anatomical features, developmental grooves, perichematia, superficial scratches, all these little things we were able to keep by using all this sequential polishing technique. So again, the amount of the amount of superficial texture that you are going to be able to achieve with your patients is going to be depending upon what they present and what you want to achieve. If you want to do 6 or 10 of composite veneers, but if it's only 1 or 2 teeth that you're restoring, you're going to have to reproduce whatever they have on their natural teeth, and this is going to be most likely age dependent. The younger the patient is, the more of these features you're going to have. The older the patient is, the less of these anatomical features you're going to have, so the less of this sequence that you're going to need. But one thing that you're not going to be able to get away from most likely is going to be your superficial scratches, and it's going to be obviously the high luster that you want to achieve towards at the end of your finishing and polishing technique. And this brings me now to my tip and trick number 3, which is going to be sharing with you some real patients so that we can just walk you through the process of the actual finishing and polishing technique that we just described. Again, we're not going to go into the details of the actual restorative technique because we do have a webinar, and you can go back into our on-demand library and find that webinar for for just developing or how to create or recreate nature using a composite resin. But now we're just going to go into the actual details of the polishing sequence. So I want to share with you this particular case, and you can see this is a cross-polarized photo where you can see all the teeth are natural. The patient doesn't have the best home care possible, and you can see a little bit of thickening of the gingival periodontal biotype. But we were able to send her home, get her get a cleaning done. She was improving her home care so that when she came back for us to treat her, and obviously under rubber dam isolation, we're going to go back and just redo for now 8 and 9 uh, um, with direct composite. You can see that she had two composite veneers, and the reason why she had these composite veneers is because she had these white spots underneath the composite on the her actual enamel. And the previous dentist found that this was the best way to go about treating these white spots. I would have done something different than composite veneers, but this is what she had, and this is how she presented to us. So you can see on a side photo how there is no anatomy here. There is no developmental grooves. There is no superficial scratches. These are super flat, and you can see the difference between the texture on her natural enamel and the lack of texture on the composite restorations. So this is why we have to go about learning all these techniques so that when we finish our restorations, we can give back something like this. Have these superficial scratches. Look at how nice and detailed the line angles are here. You can see this flat surface in between the line angles on both. Well, this on tooth number 10. On tooth number 7, it was a little bit different, the anatomy. You can see that this tooth is a little bit more ovoid. This is a little bit more triangular in shape. So this is how nature is. And because we were only going to be working on 8 and 9, we're going to have a combination of of the anatomical features present on both of these laterals. The beauty of dentistry and the beauty of the way that our teeth were created is that because 7 and 10 are apart, they're not one right next to the other. It really doesn't affect as much this difference that as it would affect having this type of different anatomy between 8 and 9. So we're going to have to choose one shape for 8 and 9 so that we can go, and you can see the difference between 7 and 10. This is more square, this is more triangular in shape, but we're going to have to choose, and we're going to go with the square because of the volume and because of the space. And the other thing that I want you to see here is the lack of line angles that these two composite veneers had previously. So they've been there a couple of years, so there's some wear on these veneers, but you can see that there's lack of line angles, and that's what uh, we have to reproduce when we are redoing these composites. So we're just going to go about removing these previous restorations. We want to be as conservative as possible when removing the composites. We want to remove the least amount of enamel, and we want to achieve a final product or a final substrate where we have a good amount of enamel. If we can have 100% of enamel, and that's what we were able to achieve in this particular patient, that is ideal. We're going to redo our composite veneers. We're going to do the mylar pull technique, and again, we're not going to go into details into what the technique is, but just to show you that we do give emphasis on building up the line angles, even the mesial and the distal. This is after we have completed this first composite veneer. And what I recommend when you're doing this clinically is right after you complete your first restoration, before going about and working on the other tooth, I like doing what I call my preliminary finishing. So I'm going to go about drawing the line angles and just making sure that what kind of shape am I trying to reproduce. I'm trying to achieve kind of like a combination of between a triangular and a square type of tooth. We don't want an ovoid tooth for sure, because that's not what she has. So you can see here that we have more of a triangular shape of outline. And again, we're going to go outside these line angles to do our initial finishing process. We haven't used any diamond burrs on our facial aspect. We've only go about outside that triangular shaped line angle that we were able to develop using our pencil marks. And once we do that, now we're going to go about getting the final facial contour, very close to the final facial contour. We had a little bit of a developmental groove here. This was more of a flat surface on number 10. So we're going to create a little bit of a developmental grooves. This is a young patient, and we're going to recreate that on the facial aspect. Once we are kind of done on tooth number 9, now we're going to go about working on tooth number 8. The number one reason I recommend doing this and not going about finishing both 8 and 9 and then using disc and diamond on both teeth at the same time is because now you're going to be able to use even less of amount of composite to restore tooth number 8, because now you have reduced any of the over contours that you did on tooth number 9, and this is now going to give you a better idea of what is it that you're trying to copy, because now we're going to try to copy number 9 when we are restoring number 8. That's the number one reason why we go about this initial finishing process on number 9 once we're done placing our composite on number 9, before we come back and restore number 8. And there is now, we have completed our mesial, our facial aspect, mesial line angle, distal line angle on number 8, and you can see that we were able to just slightly over contour the mesial line angle of number 8 in comparison or in relationship to the mesial line angle of number 9. So now you can visually see why this technique is what I recommend, and it's going to be a very minor finishing on the mesial and distal line angle of tooth number 8, and we're going to follow the same protocol using the same very fine pencil to mark the line angles. And then once we complete the finishing process on number 8, following the same steps that we did on number 9, I want you to look at this photo, because now we are going about the finishing process. So we're now using the pink wheel, and then we're going to use this blue wheel to get this high luster. But what I want you to see here, again, look at the amount of water that we're using. We're using water. We don't do this wet. We do the whole finishing process always under a wet condition. And, we use in our practice, we use electric hand pieces, and we actually use the B&R brand. And what I like about these hand pieces is that you can, even if you're using I'm using now the latch hand piece, but if you have if you're using your diamond burrs, you can bring down the speed. You can control the speed on an electric hand piece, going all the way down to 20,000 RPM instead of using 200,000 or 100,000 RPM, and you can still have water. Your slow speed has water coming out of the handpiece while you're polishing. And what I try to do is I try to use between 5,000 and 10,000 RPM on my handpiece underwater. So I have a little bit of spray of water coming out. So now I don't even need my assistant using the air water syringe, because the electric handpiece that I use in my practice allows me to have water present, have water shooting out from the handpiece directly to the disc and onto the tooth surface. And what I want you to see on this right-hand photo is that look at the luster, look at the texture, the superficial texture that we were able to recreate. And this is immediately after removing the rubber dam, immediately after going about using the disc and using all these burrs that I just showed you today. We did not use the big round burr because we did not want to recreate any perichromatia here, but we did use the 8888 and the 8801 burr so that we can recreate the scratches, the superficial scratches on these teeth. And this photo was obtained immediately after completion of my restorations on 8 and 9. Look at the high luster. Look at the luster, the natural luster on this lateral incisor and this lateral incisor, and look at the reflection of light that we were able to achieve on both 8 and 9 within our composites. So this is actually this is using a softbox in order for me to obtain this photo, just to show you how much of a luster I was able to reproduce in relationship to the patient's natural teeth. And all this by using this sequence of polishing rotary instruments, starting with your medium coarse disc all the way down to your silicone wheels to get this high luster. But, again, this is going to take you approximately, 20 minutes per tooth in order for you to, it takes some time, and you have to use stall speed, and you want to go slow, and you got to make sure that you air dry so that you can see how much of a luster you're achieving until you're happy with the result. So again, this is how we started this case. And I want you to show you now without the softbox. This is just a regular intraoral photo using a twin flash. And I want you to see how this anatomy walks in and was able to be developed in my composites. Look at the halo effect that we were able to reproduce on the incisal thirds, but most importantly, the line angles, the shine in our composite, the developmental grooves, all these little characteristics that are so important in dental anatomy that we all know. And they are very important in order for us to reproduce in our completed restorations. This is the before photo on the lateral side, and this is the after photo on the lateral side as well. And I just want you to look at the developmental grooves on both of the teeth and the way that the light shines and reflects on these teeth. This is more of a full smile photo before and full smile photo after. We were able to give these 8 and 9 a little more of dominance effect on this young patient's female patient smile. You can see that these were in the previous smile, they were shorter. The centrals were almost shorter or kind of like the same length as the laterals. We were able to give her a little more volume on those on both 8 and 9 to improve her smile. And just to share with you one more case, again, this is two completed, quote unquote, completed composite restorations on 8 and 9. Patient was very unhappy with the results. So patient came to our practice and he wanted us to remove those restorations and to redo these restorations. And again, I'm not going to go into the technique details, but you know about the mylar pull technique. Here is now our initial finishing process. Line angles are outlined. We're going to work outside these line angles to get this more of a square type of tooth. And you can see that we have been able to modify the shape of the tooth from where we were at initially. Once we do this initial reshaping of this tooth, now we go about working on the other tooth. And you can see how easy it was for me now to try to reproduce what I was able to achieve on tooth number 8. I'm able to reproduce on tooth number 9. So this is why I recommend always doing one tooth first. Try to do your initial finishing process on that tooth and then go about restoring the tooth number 9 in this particular case, so that now you can reproduce and you can try to match both of these teeth. And again, we went through about the whole steps of, the disc, the burrs, and the shape guard towards the end. This is how we started. And this is 1 week post-op. And I want you to see superficial scratches present right here in the middle aspect of the tooth, developmental groove, very little scratches here present, a little bit more over here, developmental grooves. Look at the line angles and look how we were able to even blend in beautifully the line or the interface between our composite and the actual tooth structure of our patient. This is a single shade of composite used to restore this particular case. And again, look how we were able to blend in well that transition between the composite and the tooth structure. And this is the final smile of our patient. You can see here, this is how he presented. And this is right after we had completed 8 and 9 with composite, and the difference in shape and how we were able to just give this patient back more of a anatomical tooth, a tooth that really represented the anatomy that he had on his natural neighboring teeth. That's what we have to do. That is our ultimate goal when we're doing cases with direct composite restorations.